information was there on how to frame the country networks, and the purpose was there as well. I think what most of us battled with in country was the question of authority and getting activities at a collective. In South Africa, live in Rwanda now, we had a steering committee going, we had objectives and activities, but it just, faded down. And I'm sharing this to say to all of us that the country networks, you will hear more about them tomorrow, they need to be strengthened as we take this work forward. In fact, what happened in South Africa was that a organization would have an activity and some of us would join, but it wasn't like this an activity from the MenEngage Alliance. Sonke had some, the women's movement had some, we joined them, but I think moving forward we need to coordinate the network much stronger and better moving forward. Then in Namibia, everything started well. There were challenges in terms of why is Lifeline taking the lead? We've been here for some time and all of that. And I think the position we have taken in Namibia was that because it's a very strong women movement, women network there, let's rather work via the women's network to progress our calling as well. I forgot about Kenya. We also have a network there. It just started and things are still at a very preliminary stage. Tanzania was a shining star. They had lots of activities together during the 16 days of activism last year. But I know as I speak, since December they haven't had a meeting. So the key word of strengthening our networks still goes to Tanzania as well. I think by the time Mozambique came into the fray, we had learned a few lessons in terms of coordination challenges and how to approach certain things. Today I think Mozambique is the shining star. The new kid in the block is the shining star as I speak. For the first time, the MenEngage in Namibia, in Mozambique, had a public debate on masculinities and gender-based violence for the first time in the country. As I speak on the 19th of October this month, they are going, for the first time, the country will speak about LGBT issues for the first time. And this is championed by the MenEngage. And our special thanks to Institute Promundo for helping with capacity building for the network and gender health there as well. So in short, I'm saying we've been here, we've been doing some work. We need to strengthen our movement, our country networks. You'll hear more about this tomorrow. And hey, we want to do things together, looking at policy issues that we have heard already from the other speakers. And with you and everybody else, and the ones that we still have to call, I think we can say, as we say in South Africa, Malita continue. Thank you.
Thanks very much to Misani, and thanks very much for that frank assessment of where things stand with the MenEngage networks. Lots of exciting work has happened. There have been challenges, as we've heard, and lots of exciting work to continue both in building new country networks and then strengthening the existing ones. So next I'm going to ask Pirishel Kamei, who is a long-time anti-apartheid activist, social justice activist, was detained in the 1980s here in South Africa for his anti-apartheid activism, and is now very involved in the civil society, in the Commonwealth Civil Society Advisory Council. And Pirishel will talk a little bit about some of the existing initiatives that the Commonwealth Civil Society networks are involved in and how those might link to the MenEngage processes. Pirishel, thank you very much.
Services that we require in our countries. In December 2007, there was a program where about 560 civil society workers participated in a survey to demonstrate how NGOs are using wireless technology. 86% of the NGO workers said that they use mobile technology in their work. And these workers were mainly based in Africa and Asia. And there's less of this technology being applied in Europe and America. The workers that were surveyed said that voice and text messages were the most common applications, but others were also using photos and video messaging across to their head offices. Still other workers were using it for data collection and transfer and multimedia messaging. And the key benefits they saw of this technology was time-saving, mobilizing, organizing and reaching audiences, and reaching academics they had not previously been able to reach. I believe that out of these discussions that you're going to have over the next couple of days, that you really need to focus on how do we increase the participation of mobile technology. In South Africa, Project Masuluke sent 1 million free text messages a day to invite people to be tested, with calls to the National AIDS helpline increasing by 200% over that period. This was, I believe, technical mobilization at its best. In South Africa, we have a weak state health sector. It has forced civil society to advocate for improved treatment, but also uses technology to provide accurate, time-bound information in a clear and concrete way. CellBack in South Africa has created its Efficare program to work with the public health workers to provide home-based care for HIV/AIDS patients receiving ART treatments. And if you scan the literature across Peru, the United States, Zambia, Kenya, Indonesia, you will find examples of people using mobile cell phone technology. We need to learn out of these challenges and make sure that we can apply the lessons adequately on the scourge of HIV and AIDS. Now the lessons learned, we really need to focus on, and my key message would be that we need to ensure that in terms of licensing arrangements that organizations have, commercial organizations have within each of the countries, that we ask that social messaging using mobile technology should be provided for at a reduced rate, because we're finding that the cell phone companies in this country and elsewhere in the region are providing that social messaging services only at a commercial rate. And a particular message needs to come out of this conference to say, let us look at a subsidized messaging system, because the corporates are making sufficient funds out of using ordinary applications of mobile technology. Thank you.
Very sure, thank you, and thanks very much for getting us started and thinking about strategy and ways in which we could use ICTs. Colleagues and comrades, it's my great pleasure to introduce you to the Regional Deputy Director from UNICEF, Simone Oliocha-Malumia. I'm sorry. UNICEF. It's a great delight to have you here. Thank you very much.
My esteemed panelists and colleagues, it's a pleasure for UNICEF to share this space with you today at this symposium. UNICEF, the United Nations Fund for Women, provides both financial and technical assistance to innovative programs and strategies that foster women's empowerment, women's rights, and gender equality. UNIFEM focuses its activities on 4 key strategic areas. They are reducing feminized poverty, ending violence against women, reversing the spread of HIV and AIDS among women and girls, and of course achieving gender equality. In our regional office, we work within 14 countries in the region, and we are based in South Africa. UNIFEM is committed to gender equality